From Rectangle Health, this is the Modern Practice Podcast. Every episode, we tackle a timely topic to help you stay current and simplify the business side of healthcare. Without further ado.
Hello, everybody, and welcome back to the Modern Practice Podcast, presented by Rectangle Health. I'm really excited for today's episode as we'll be joined by Kimberly Howland, Senior Vice President of Product at Rectangle Health. She holds a Bachelor's of Science in Biology, a Master's in Medical Sciences from Harvard Medical School, and a PhD in Immunology from Harvard University. Kim brings over 20 years of experience developing and commercializing new technologies in healthcare. She has experience in unifying product offerings, creating development roadmaps, implementing those enhancements to enable smoother, more efficient, and elevated experiences for users. Kim has a deep understanding of the needs of the industry and has been an integral player in the advancements in Rectangle Health solutions and offerings. Kim, I'm thrilled to have you as a guest on the show, and I'm really looking forward to this conversation. Thanks so much for taking the time.
Thank you so much for having me. I'm delighted to be here.
Well, the pleasure is all mine, and I know I gave you an intro, but I'd love to hear from you about your career path and what led you to Rectangle Health.
Yeah, well, it was a convoluted and unplanned pathway for sure. But after graduate school, I spent 10 years consulting, largely to biotech and pharma companies, on developing targeted therapies and companion diagnostics. And that was fantastic, but part of my work also involved doing strategic planning, portfolio planning, and M&A. And one of the companies I did a lot of M&A work for, Omnicell, brought me on full-time in their strategy business development group. And I created some strategic plans for them, thinking about what products to develop, what to sunset, how to enhance, and quickly found myself leading product. So that's really where I learned the ins and outs of software and hardware product development. It was fantastic. Loved software, didn't as much like hardware. So then I ended up working with a friend of mine from consulting at Diameter Health, which we worked on a software solution for data interoperability, and that was SaaS. And that's really where I learned the ins and outs of SaaS. I went back to Omnicell for a SaaS division and worked on integrating a number of different companies and solutions into a single platform and a single user experience for pharmacy. And some of those solutions involved an omnichannel communication solution, scheduling, helping pharmacies bill and get paid for clinical services by payers. And a recruiter reached out, talked to me about Rectangle Health. And while I knew nothing about patient payments, some of that healthcare experience, SaaS, and those solutions I already had experience with were relevant. So here I am.
Amazing journey. And as I mentioned before, this is the reason why I'm excited to have the opportunity to chat on the show, because of all that depth and knowledge. And where I really want to start is getting your take on Rectangle Health's practice management bridge platform and where it fits into the day-to-day operations of a practice.
Yeah, of course. So Practice Management Bridge aims to be everything that the PMS or the EHR is not. When you talk to healthcare providers, most of them didn't go to school to run a business. They really want to focus on patient care. But healthcare is a business. There's a lot of things you need to do that doesn't involve patient care. So you need to hire and train staff. You need to make sure your staff is up to date on regulations. You have to bill and get paid both by payers and by patients. And you have to have good ways to engage with your patients. And some PMSs or EHRs are doing some of those things, but there's still a lot of gaps. And that's where we really want to sit and really help providers fill the gaps and be everything else to them that their PMS or EHR is not.
Yeah, you mentioned filling in the gaps, and I want to discuss that for a minute if we can.
Well,
first, can you talk to me a little bit more in depth about what those gaps are? And second, as far as the development from the Rectangle Health side, what's been done to fill them?
Yeah, that's a great question. So if we think about our day-to-day lives, so many things we can do involve these handheld computers we're all carrying around or other digital ways to engage. And unfortunately, healthcare is pretty far behind on that. So if we think about a patient perspective, if I want to schedule an appointment with my dermatologist, I have to call the office during business hours, wait on hold, wait through the messaging, find a time that works. And that would be much easier if I could go online and schedule at my convenience and not need to interact with another human to do that. So then I've scheduled an appointment and I'm very busy and I forget that I've scheduled that appointment. Those reminders that you get, hey, you've got an appointment tomorrow with this physician, this time and place, very, very helpful to making sure patients show up for the appointments that they have scheduled. So we've solved some of those problems through our Practice Management Bridge engagement solution to help automate scheduling and those reminders. Now I've received care, and often a month later, 2 months later, you get a paper bill in the mail, right? How much do you owe after your healthcare or insurance didn't pay for all of it? And then I either have to find my credit card and write my credit card information in there, or go get my checkbook and mail that piece of paper back to the provider. How much easier it is if I can just get a text or get an email, click a link, and pay digitally. Again, so much easier. I can do it when and where I want to do it. So Practice Management Bridge payments really helps patients pay their providers and for the providers to get paid for the work they're doing. And then finally, from a compliance perspective, HIPAA and OSHA, it's a lot to keep up with. And so being able to have templates where we help practices get those policies in place and keep their staff trained really helps them take away all that mental labor of keeping up in the time. So really trying to save the provider's time, let them focus on patient care. They're happier, patients getting good care are happier, everybody wins.
I love that. And we know every practice has a unique set of needs on the administrative side. You just covered a range from the payments, from the financing, compliance, all the above. And we also know that not everyone is on a single practice management system. There's multiple players in the space. So how's Rectangle building and developing Practice Management Bridge to meet the needs of the practice? And does it seamlessly sync with any practice management solution?
Yeah, that's a great question. So we're not in a unique position. This happens a lot. But we're dependent on getting information from the PMS or providing information back to really provide that seamless experience. And we want to be as open as we can. So some PMSs maybe have some parts of our solution or they have it on their roadmap. And it doesn't matter to us. We just want to fill what gaps are there. So providers can take bits of our solution or all of our solution. And we want to be as deeply integrated as they will let us. We've also developed ways to have files imported in a less integrated fashion, but with a very few exceptions of some scheduling functionality that requires a two-way interface, we can have our entire platform available however the PMS wants to work with us.
And so with all that, how are you and your team sort of keeping a finger on the pulse of the industry and the needs of the providers, and how important has that communication been in enhancing Rectangle Health solutions?
Yeah, communication is key. So my product team, we want to be talking to customers as often as we can. It really helps to hear firsthand the needs or the problems that those customers still face. So that's one mechanism of getting feedback. We meet regularly with sales, support, delivery, and our customer success managers. So all of the information that they're learning from customers is feeding into product. We go to conferences, which is a great place to talk to a whole lot of customers in a short amount of time, and also to see what other companies are doing to help solve these problems. And we have a place in the software where customers can leave feedback right in the application, and we read through that. So we take all of that information and try to solve the biggest problems first for the customers and prioritize our roadmap that way.
I think that's a perfect segue, speaking of the roadmap, into yet another component of Practice Management Bridge, which you mentioned earlier, which is patient financing. Originally launched last year, there's been some big changes, and those changes now give providers the ability to increase their case acceptance and the patients the ability to easily manage that cost of care. Can you get into what some of those big changes are and how it's going to impact a provider's revenue cycle? And did that come from hearing from the teams that you're speaking to and the feedback inside of that system?
Yes, absolutely. So we released patient financing last year, and it was really sort of a pilot in that we had one plan commercially available, but you could access that financing and have patients be invited to apply from the application itself. And that went over very well with providers. But what we found was we didn't have the breadth of financing options that some provider segments or patients needed. So we worked with our partner and we created a wide variety of new plans that have higher financing limits or are more tailored to specific types of care a patient may need. And we've made that available through practice management bridge payments. And we're very excited for our providers to take advantage of that and really be able to offer their patients more options. We become far more competitive with the market leaders in financing. And so we're pretty excited about this.
Yeah, that's incredible and always really speaks to something we've really heard a lot on this show, which is Rectangle Health's consultative approach, listening, adjusting, adapting to the needs of the industry. So I think those changes speak to that approach that Rectangle takes for sure. So for this last segment, before we wrap up, I want to get into a partnership that stemmed from identifying a huge opportunity to save providers time and effort, straight through processing with Zealous. A while back, I had Joshua Cooper from the Rectangle Health integrations team on the show, and he said this was groundbreaking. So from your perspective, why is it groundbreaking?
It's a great question. So obviously, providers need to get paid by the different health insurers that are out there. And shockingly, a fair amount of that still happens with paper checks, particularly in dentistry. Well, there's a lot of electronic or digital ways that those payments can flow. So virtual credit cards is one of them. And how that works is the payer provides to the provider a virtual credit card, and that credit card can contain payment for many patients, and with every patient, multiple procedures. The provider goes and looks to see if they have one of those cards available and keys it in, and that payment is available next day. So one benefit to the provider is they get that funding more quickly. What straight through processing does is it automatically catches that card and processes that. So the provider doesn't have to think about going and looking for the payment, saves the time of keying that in. So that's the first bit of value. Now, when I mentioned all that the transaction could have multiple patients, multiple procedures, payers provide a different set of information. Different payers provide a different set of information. And what we've done is make a standardized explanation of payment. So when the provider goes into practice management bridge and looks at the transaction, we've broken it down so you can easily see what patients you were paid for and what services. So that's the second bit of value there, is making that standard. And then the final bit of value is with one click of a button, you can post that information back to the PMS. So that's a massive labor savings for the practice. So really trying to make it easy and provide more value to the practices by taking that digital form of payment.
It's amazing stuff and a huge partnership providing a ton of value. For our listeners tuning in, if you'd like to learn more about that Zealous partnership with Rectangle Health, I'll have a link to an article in the episode description for you to check that out and learn more. And Kim, I'd love to also give our audience a chance to connect with you and ask any questions they may have and learn more about the innovation coming out of Rectangle Health. Where can they do that?
Yeah, you can connect with me on LinkedIn and drop me a message there, and I'd be delighted to chat.
Perfect. I'll be sure to drop a link to your profile in this episode's description as well as a link to Rectangle Health's site where all our listeners can find a ton more information about Practice Management Bridge. Kim, this has been highly insightful and fun. Thanks so much for taking the time to join me.
Thank you for having me. It's been great. These questions really help our customers and the market stay up to date with some of the technological innovations. So that's fantastic.
Absolutely. The pleasure, like I said, is all mine. And I'm looking forward to having you on again real soon. For our listeners tuning in today, if you've enjoyed today's episode, hit that subscribe button on your favorite streaming channel. Leave us a review. Let us know how we're doing. And as always, be on the lookout for a new episode of the Modern Practice Podcast coming your way soon. Thanks for tuning in. Till next time, everyone.
Thank you for listening to the Modern Practice Podcast. If you enjoyed today's conversation, subscribe on Apple Podcasts, Google Play, Spotify, or SoundCloud for new episodes. And follow Rectangle Health on social media for more helpful information, news, and event details. Thanks for tuning in.